Okay, welcome to this session. And today we have a guest with us, Dr. Rijo Mathew Choorakuttil, who is the Secretary of the Kerala IRIA and has been the Secretary for many years now consecutively and has been awarded the Appreciation Awards by the National IRIA for his wonderful work in the state level. Dr. Rijo Mathew Choorakuttil is also well known as the person who initiated the Samrakshan program that aimed to reduce perinatal mortality in India. And he was the national coordinator for that program. And given the amount of work that he has done in multiple fields in radiology, the National IRIA has entrusted him with the roadmap to develop a preventive radiology program at the national level. And let's take some time and hear from Dr. Rijo Mathew what the preventive radiology program is all about. Is it something new? Is it old wine in new bottle? Is it new wine in an old bottle? Or is it just new wine that everyone should get a flavor for and enjoy? So let's hear from Dr. Rijo Mathew. So welcome, Dr. Rijo.
Thank you. Thank you, Dr. Praveen. That's a wonderful question. In the sense, this concept of preventive radiology is a space that I feel the radiologists and the Indian Radiological and Imaging Association has to explore further. I know right now this space is not being defined well or not being seen well by many of our colleagues, many of our radiologists. But in fact, there is quite a bit of space for preventive radiology in the whole realm of preventive medicine or the preventive medicine, in the sense that imaging biomarkers or early markers of disease is something that is part of screening tests that is being done for cancer detection or for lifestyle diseases or even for some of the infections. So this is one area where imaging or radiology has played a significant role all over all these years, but it's not being addressed or not being properly nurtured in a way that it should be. So preventive radiology basically has got a role in the clinical radiology, has got a role in the diagnostic radiology, as well as in the interventional radiology. Right now, we know about these three areas of radiology: the clinical radiology, the diagnostic radiology, and the interventional radiology. Clinical radiology is something that our President, Dr. C. Amarnath, has been encouraging us to focus upon. And clinical radiology is when the radiologists start taking the history and talking to the patient, communicating to the patient to understand what exactly is the disease process, history of the disease process, and to come and to use their clinical skills to address the radiology needs in a better way. So this is exactly one area where preventive radiology has got a focus, in the sense that screening tests where we can say that, say for cancers, one of the early diagnostic tests that we can do with which modality is ideal for which cancer. All these things is something that preventive radiology has to focus upon. Similarly, another area where I feel is preventive radiology will have a significant role is right now we have got lots of data that with us from the imaging tests or imaging modalities that we do in terms of CT, MR, ultrasound, or whatever it is. So we are focusing on a particular disease and its pattern for a diagnostic workup as well as for a differential diagnosis. But in the same imaging modality, that's the data provided by these imaging modalities, there are a lot of early imaging biomarkers which goes undetected right now, maybe for the cancers, maybe for the lifestyle diseases, with respect to organs like kidneys, liver, or other end organs. Maybe some early subtle changes in kidneys for diabetic renal disease, diabetic nephropathy can be picked up if we pay enough attention to the existing data that is being used for our diagnostic workup of these patients. We are not paid much attention into this particular area. So that is one area where preventive radiology has to focus for early imaging biomarkers from the existing data that we already have with the with the modalities that we are using right now. And similarly, there is a space for preventive radiology in interventional radiology too. So right now, with the interventional radiology already focuses on minimally invasive minimally invasive methods to treat a disease. So preventive radiology in that way can help further advancement of many diseases if we pay more attention and pay if we pay more attention into it. And definitely preventive radiology also has got a role in interventional radiology. So there is a lot of space for preventive radiology in the current practice of radiology and imaging, whether it be clinical radiology, whether it's diagnostic radiology, or whether it's interventional radiology. This is exactly the space that we want to explore with preventive radiology wing of Indian Radiological and Imaging Association.
Okay. Now, there are two things that I'm seeing here. One is that you're looking at optimizing an existing clinical skill. So you're not really looking at a space where you have to add in a lot of infrastructure, add in a lot of resources, put in a lot of investment. It's more about optimizing a skill that has already been taught you over the 3 years of your post-graduation course and over the period of a fellowship after that, if you have done a postdoc fellowship. The imaging biomarkers is an area of interest. When you say that you can use the imaging biomarkers for early detection of a disease, what are the current ways that people now try to identify a disease early, and where does the imaging biomarker bring in an advantage?
Okay. Praveen, there is actually, your question had two components. I'll answer the two components. The first one that you asked, I'll just add on to what I already said, that we right now wants to focus on this imaging biomarkers, which already exist there, but only thing that is required is we need to pay more attention to that, or we need to have certain guidelines, and we need to have some skill enhancement programs for the radiologists to properly identify that space and to report them. So apart from that, you asked whether does it require any technology investments or infrastructure. Of course, there is one area where preventive radiology can focus upon with the help of some investment is networking of these already centers which has already got this data, which I'm sure in the period of National Digital Health Mission, maybe radiology will be the first modality that will integrate it in a better way with much productive yields. So that is another area where we need to network with the diagnostic centers or the hospitals for this data, which can be utilized for the patient's benefit in a much better way with the help of artificial intelligence and deep learning too. So these are areas where preventive radiology can expand into, apart from the diagnosis and the skill enhancement component for the radiologists to detect the imaging biomarkers and with respect to the common diseases that we come across in the society. The second part of the question that you asked me is what are the specific areas that right now we can start working on preventive radiology with the use of imaging biomarkers. Right now, I can see 4 or 5 areas that we need to we can start working with. One such area is the diagnosis of fatty liver disease, the non-alcoholic fatty liver disease, and the quantification of fibrosis with the help of elastography, both the ultrasound elastography as well as the MR elastography. That is one area that needs a lot of attention right now with the kind of statistics that's available from the country, from different parts of the country, that we need to address this particularly, and imaging is going to play especially for the quantification of fibrosis. Imaging, I'm sure, will be playing a very big role in this particular entity, that is non-alcoholic fatty liver disease. The second area which I said is, again, the imaging biomarkers for chronic kidney disease. So that is one area, maybe diabetic kidneys, diabetic nephropathies, and conditions like that. We already may have data on these particular patients, but we have not looked at them with the kind of attention that it deserves. So that is one area. Another thing that I want to focus on is atherosclerosis imaging and endothelial dysfunction. So that is one area that is very, very linked with healthy aging. So healthy aging is one concept in preventive radiology that we need to promote. We need to promote in this way that if by regular by checkups at regular interval with the help of biochemical and imaging biomarkers, we may be able to know the exact aging process with the help of the atherosclerosis and endothelial dysfunction this particular individual is going through, and maybe depending on the severity or the scoring indexes that we can develop at a little later, we will be able to say them that this particular individual that maybe at the age of 40 you're having an atherosclerosis process or an endothelial dysfunction that will be usually seen at the age of 70. So it's high time for you to go in for lifestyle modifications or some medicines or drugs that can help you reduce the progression of atherosclerosis as well as the endothelial dysfunction. So this is another area that we need to focus upon. Again, with respect to the use of CT coronary angiographies, the calcium scoring, and the carotid Dopplers for stroke prevention, and also the carotid intima media thickness for assessment of atherosclerosis. So there are lots and lots of imaging tests currently available, which has to be integrated and directed towards this particular cause. So these are 3 or 4 areas. Apart from that, one of the most important areas that's already being worked out is the early detection of most of the common cancers in our country. So these are 4 areas that I feel preventive radiology has got a very, very significant role. Apart from, in a way, I must say that our program of Samrekshan is another application of preventive radiology. It's actually a combined screening for preeclampsia and fetal growth restriction, both of which constitute a major cause of perinatal mortality or neonatal mortality in India. So if you apply that to the obstetric imaging or the perinatal radiology, so Samrekshan in a way is it's an application of preventive radiology.
Do you see radiology now shifting to a position of being the gateway to clinical medicine from its current position, probably as a diagnostic reporting modality? Do you see that preventive radiology can shift radiology to the front and be the gateway to direct more focused, more targeted clinical medical approaches?
I do certainly believe there is a scope for radiologists to enter that particular space, even though conventionally radiologists and radiology was taught in such a way that it is a paraclinical subject where you are helping out your clinicians to arrive at a diagnosis, you are helping your clinicians to guide the treatment and all those stuff. But if you look at the healthcare services in our country, if at least this pandemic has not given us a clue about the poor infrastructure, poor healthcare services in this country, no other time in the human history in the history of this country can give you enough clues to put more emphasis on the already underdeveloped healthcare services in this country. So we have got, so say for example, we have got 3 crore pregnancies in this country every year, out of which the national NHFS data in 2015 says that there is only 60% of them who gets at least 1 ultrasound during their pregnancy. So that means only 1.8 crore gets at least 1 ultrasound. Ideally, we look at it, look at every pregnancy that it requires at least 3 ultrasound scans at 3 months, 5 months, and 8 months for a proper evaluation of growth and fetal environment and the anomalies. So if you look at that point, 3 crore pregnancies requires 9 crores of ultrasound tests. So where does it stand right now? It only caters to 1.8 crore, at least 1 ultrasound test that is happening. So there is actually a void of 7.4 7.2 crores of tests, ultrasound tests. That's only for pregnancy scans I'm talking about. So if you look at the abdomen scans or the liver scans or the renal scans or the cardiac scans, for a 136 or 138 crore people or more than 1 billion people, you can understand that here's a huge space which is totally not addressed. There is a huge problem that is totally not addressed, and there exactly is the space. The existing clinical number of clinicians or number of infrastructure, number of facilities has not addressed it properly. So radiologists can leverage the use of technology to reach out to maximum number of people, to the more than a billion population, and can have utilized their technologies to utilize the preventive radiology, and can extend the role of clinical services even in remote areas with the help of teleradiology, or even with the help of artificial intelligence, deep learning, and robotics also. So there is a lot of space I can see here, but I think the first and foremost thing about all these things is people need to be aware of this particular space. They should understand, they should see this space, and they should work on it, and they should put more effort on it. If they are not ready to get out of their comfort zone of diagnostic radiology alone, then they may not be able to address this particular component, which has got a huge potential, I can see.
So carrying on from your point about the underutilization of existing healthcare resources, and are you then saying that the preventive radiology program can be pan-Indian across all healthcare settings, and not just limited to an academic or a urban metropolitan top tier city settings?
Yes, we have to agree that there is a reality in healthcare right now. One, there are three tiers of healthcare: the primary, secondary, and the tertiary healthcare. Tertiary healthcare are more or less limited to metro cities or mini metros, and they are slowly percolating down into the tier 2 and cities now. But when you come to the secondary level of healthcare, they're limited to the district hospitals, which are grossly under-equipped, which are not providing the kind of services that they should have. And when it comes to the primary level of healthcare in the rural and the suburban areas, there is a gross deficiency that all of us can see through, which is can radiologists address all the three segments? I think right now radiologist presence may not be that much in the primary level, but if the radiologists are willing to take up the use of leverage into that is doing more with less efforts with the help of a technology, that either by using artificial intelligence or robotics, or with the help of trained radiographers or trained physician assistants, if we can extend our expertise to the rural as well as the primary healthcare or secondary healthcare, I think radiologists has to come into the forefront and set the guidelines to work upon these imaging biomarkers, early detection, focus on early detection, and the preventive radiology and preventive medicine concept. I think there is a tremendous potential here, which is right now totally untapped.
So that's an interesting stream of thought. And does the current curriculum have to be changed to integrate the preventive radiology program, or is it something that's already inbuilt into the existing medical curriculum?
I'm afraid right now the focus is not there. Right now, the focus is more on diagnostic radiology, not even for interventional radiology at the postgraduate level in radiology. So that all these things becomes a post-doctoral fellowship kind of thing. But that is not the ideal way to look at it, or ideal way to develop it. Especially the preventive radiology space is something that radiologists can, the radiologist has to utilize the because right now in the radiology PG program, there is not much of a clinical emphasis being given, or not much of a clinical skill enhancement program. Not much, many times the radiology postgraduates may not have much communication with the patients. They again will be looking at the images, or will be doing helping out the technicians. And right now the focus for preventive radiology, if you want to bring it into their curriculum, then the clinical radiology has to be given sufficient importance. Clinical and preventive radiology, I think, should be integrated into the curriculum, and then only the things will start changing. So the road ahead is a little difficult one, I do admit.
So you see the preventive and clinical radiology being sort of the bread and butter radiology, where they interact with patients and they have the first contact and direct patients for better medical care, sort of filter off who needs what type of care, who doesn't need what type of care, and then make sure that the tertiary centers are not overloaded with the, let us say, the minor headaches or cold or flu or things like that, and that filtering happens appropriately to appropriate levels of care. So thank you, Dr. Rijo. It's been wonderful having you here, and I hope to have more conversations with you as you work further on the preventive radiology roadmap. And I think it's a very interesting concept, something that is new and innovative and has the potential and possibility to change the way that medical disciplines interact with each other, and all with the consumer or the person who is receiving care kept in mind. So I think there's a lot of possibility and potential there. Thank you so much for being with us. And I hope to talk with you on a regular basis, and for you to share your wisdom and experience with us in the future as well. Thank you so much.
Thank you, Dr. Praveen, for your time. And I think these concepts has to reach as many as possible amongst the radiologists, and also to the general public. And definitely, we need a lot of work to be done in this particular. That's why this preventive radiology wing was formed by Indian Radiological and Imaging Association. I have a good team with me to develop the guidelines and to work on this particular space. I have Dr. Chandar Lulla from Mumbai, Dr. Subair Kazi again from Mumbai, and Dr. Uma Maheshwar Reddy, Dr. Ragesh Chamkandigar, Dr. There are a lot of people who have got a passion towards this particular subject. Dr. Ghanshyam Adesharna from Surat, Dr. Devanand from Coimbatore, so there are a lot of people who are showing a lot of interest in this, and we have already published a white paper and a roadmap to fetal radiology, and I'm sure we'll be able to work on these lines, and we will continue these conversations and get as many people as possible to be interested in this particular subject. Thank you for your time.
Thank you once again. Thank you so much.